I think it was really good timing in terms of really trying to think or rethink the way we approach health and fitness, and the terminology that we use. And I think over the last probably 10 years, especially at the time I've been in the industry, it's kind of like gone away from what it really should be. And we've kind of lost the meaning of what health and fitness is. So why now do we need to rethink all this? So essentially we're in the midst of a worldwide pandemic. So it kind of gives us the opportunity to kind of stop, breathe, take a deep breath, and just kind of process what's really going on and what actually is this pandemic. It's a health pandemic, essentially. So we need to look, it's also giving us the opportunity to look at our own health status in terms of our mental, physical, emotional, and spiritual health, but also look at everyone's health as well in terms of the way we interact with the environment. We're also realizing our health and well-being is actually more important than ever. There's a lot of health and fitness experts and even doctors coming out saying that, like, we the individual, or we, our immune system, or we having a high level of well-being can actually help defeat this. And we're kind of, that Western mentality is kind of leading us to kind of faking ourselves out that, oh, someone else will sort it out, rather than let's be the machine that sorts ourselves out. So therefore, the likelihood of someone else to get this is actually going to be quite low as well. So if everyone's really healthy and looking after themselves, the likelihood of everyone becoming sick and really ill is actually going to be low, which therefore reduces the burden on the healthcare system and reduces the burden on society. And we'll probably be able to move through this a lot faster as well. So definitions: health is the absence of illness or injury, and this is Western ideology. So if we have no illnesses, no diseases, no injuries, we're healthy, or that's health. Optimal health is not a condition of an individual, but a state of interaction between self and the environment. So what that really means is basically the way we interact with ourselves and the environment, and vice versa. Fitness is the condition of being physically fit and healthy, and wellness is a state of being in good health, especially as an actively pursued goal. So wellness is something we have to continually strive for, and this encompasses the 4 spectrums of health, which we'll get to in a little bit. What's becoming the norm? Health isn't something that we can simply define as good or bad. All foods are inherently good and bad. All exercises are inherently good and bad. It all depends on the individual and the environment, so home, work, study, social life they live in. Now, what's becoming the norm, part 2. So some experts on social media are pushing products, services that lack the underpinning of positive health outcomes, and dismiss current research, and lack credentials, qualifications, and experience. Because of the pandemic, more and more information is coming out on social media. So, and this is probably the biggest point, is health is not fixed. Health fluctuates within a range, fluctuates all the time, and it's very dynamic in nature. And when I get people coming in, it's like, oh, I'm just going to train to this point, and when I'm at this point, I don't need to do anything more. Unfortunately, it doesn't work like that. It's like, if we have a plant, an indoor plant, and it requires water on a daily basis, you're not just going to water it, put 2 liters of water, and that's it, and you've got to leave it for 2 months. So, no, you're going to drown it, and you're not going to just water it once with just a little bit. You have to keep attending to the plant. You also got to keep attending to yourself in that case. Back to the 4 spectrums of health. Now, we all need to make sure that we all have these in check. The illness wellness continuum. So I thought this is really important to understand, is health is a scale, or the wellness is really a scale. So we're constantly moving up and down. But I think the main message with all this health that we're talking about today is our health should be number 1. It's not something about spending. It's not about spending a shitload of time on, but it's all about making consistent small efforts over time. It's something that we must continue to work on. It's dynamic in nature, and it must be actively pursued goal. As I mentioned before, there's no inherently good or bad. It's all context dependent. It depends on individual needs, wants, and current capacities or capabilities. So